so much. With this, we move to the next panel discussion, a very important panel discussion of the day on accelerating patient-centric transformation and innovation in healthcare. And for that, we have got eminent speakers with us from the hospital ecosystem of the country. We have with us Dr. Aloke Mullick, Group CEO, OMNI Hospitals. I request Dr. Mullick to come on stage, please. A huge round of applause for him, please. We have with us Mr. Neelesh Shinde, Group Chief Technical Officer of Jupiter Hospital. And we also have with us Mr. Sudhir Nair, Senior Manager, CSG Sales Enterprise, Dell Technologies. May I invite Mr. Sudhir Nair to come on stage, please, from Dell Technologies. Rahul, if you can have a word with our team to find the speaker from Dell. But in the meantime, we can start the session. So, if I may ask, if I can start with Dr. Aloke Mullick, Group CEO of OMNI Hospitals. By the way, me, Mr. Mullick, or Mr. Neelesh Shinde, we have been interacting with each other for last 2 years virtually, or in various platforms. Perhaps we're meeting first time after 2 long years. So that's a good feeling, and hope that we all continue with this. My first question to Dr. Mullick will be that what were the principal innovations have you noticed deployed in the hospitals during the pandemic? Your thoughts on that, sir? I'm saying that what are the principal innovations or technological deployment you have seen being done in the hospitals during this COVID and pandemic, and how it has helped the hospitals?
That's a simple one. I mean, everybody started using M-Fine, I guess.
Okay. I think Mr. Sudhir Nair has also joined us on stage from Dell Technologies. Yeah. Yeah, Mr. Mullick, please continue.
So the innovation during the pandemic was, I mean, everybody got onto telemedicine platforms. And then suddenly, telemedicine platforms became very popular. With so many companies coming in, the government of India finally validated telehealth and telemedicine consultations and made them legal. They were not legal earlier, and doctors are scared. And lots of telemedicine companies made a lot of money, and that's it.
But if I may, I'll just take this. I think this will be easy. But in terms of, apart from telemedicine, you have been a veteran in the healthcare industry for so many years. What are the positive things do you think that has happened because of the pandemic in terms of hospital infrastructure, hospital management through innovation?
I really wish a lot of things could have happened, should have happened. We yet don't have, not only in India, anywhere in the world, we don't yet have air quality standards. This pandemic spread through the air, and lots of our working spaces, we don't have air quality standards. A single person infected in a closed air conditioned space like this can spread the infection to anybody else, right? I remember reading in my SPM books that when the great cholera epidemics happened in England, that led to a lot of water quality standards being established, and they were followed all over the world, so that you had safe water to drink. But we don't have safe air to breathe in our workspaces today. The technology exists. In our operation theaters, we use HEPA filters. In our aircrafts, we use HEPA filters. In our chip manufacturing units, we use HEPA filters, but we don't use them anywhere else. Office goer in our Infosys campus will not use HEPA filtered air, right? It's just that the government needs to mandate this. HEPA filters need to be, once they start getting manufactured at scale, the prices will come down. Technology is there, but safe air is not there, still, despite the technology being there, right? So that should have happened. As far as innovations are concerned within the hospital, many hospitals tried many things. We have seen robots dispensing medicines, and we have seen automatic sanitizer dispensers, and lots of things people started doing without human intervention. But all of those things really weren't great shakes innovations, in the sense that they were just a response to a particular situation. The situation is gone, the responses have gone. There's nothing really long standing that has stayed with us. Even telemedicine is disappearing. We have all heard how fine prices have crashed, right? Because the business has crashed. Now, this is very sad. We need to now start discussing healthcare IT. Where does healthcare IT stand today? Healthcare IT, everything is available, solutions are available, doctors are willing to use solutions. Everybody has hundreds of apps on their mobiles. Why don't you have an EMR on your mobile? Everything is available. But then, who is going to pay the price? So ultimately, it's a chicken and egg. The government needs to mandate the availability of EHRs in hospital. Government has already published two versions of the national EHR standards. Government is yet to publish who is going to check whether a particular EHR product is complying with these standards. Government is yet to publish a list of carrot and sticks that if you have a EHR as per standards published by us, you will get, say, 10% extra payment from insurance, or you get 5% extra payment here, or you'll get dock payment if you don't. This is how NABH came, right? NABH came with a big carrot and stick, and that's why everybody ran for NABH, but nobody's running for EHRs. That's the sad thing.
Right. But do you think that you talked about government not mandating various things? Do you think that with the National Digital Health Mission, correct or a push in the right direction is being initiated by government, or do you think
It's too slow. Too slow.
why you're saying so?
Yeah.
If you can explain, please.
When the carrot and stick started in US, within a period of 5 years, they went from, say, 5% of hospitals digitized to 60% of hospital digitized. The same thing is not happening in India. National Health Mission is just a policy framework. It doesn't have enough budgeting, as far as I know. And we started off with a national PHR. Even I made an account at a national PHR. It was told that you will get a national health ID, and you can connect with. I do a lot of my own personal tests from Lal Path Lab. I've still got to connect my national health ID with my Lal Path Lab ID, right? So that I can straight away get all my reports on my. So, I mean, and when I keep trying to dig deeper into this, I said it's a policy document, there is not enough budgeting support, standard stuff, right?
Sudhir, you heard Mr. Dr. Aloke Mullick. He has raised some pertinent points, pertinent problems, practical challenges. Being someone who is representing Dell Technologies, where do you say that technology and innovation can give answers to some of the concerns, if I may put by Dr. Aloke Mullick, apart from the government angle which he has spoken, can be solved? Your take on that?
So, if you see, the pandemic has actually accelerated the adoption of technology, which would have been slow in normal circumstances. And what it has led is that there's a lot of AI ML engines that is now getting deployed, in every field actually. And healthcare is at the forefront over there. The reason is because it's important to be able to predict something and being able to, prevent something much in advance. And that is where we at Dell are at the forefront of, incorporating AI ML technologies in our solutions. And especially in healthcare, we've seen that it will help in areas like both when you look at, cognitive therapy, or you look in terms of, rehabilitation. We see a huge scale there. One thing that we believe is going to be revolutionary is that you have multiple sets of data today that is being leveraged on AI ML. But the challenge is also the regulatory and the data privacy, which actually mandates that you can't, read into multiple data sets. and you need to stick to, what is available at your end. And that is where you will find a revolutionary technology that's coming in now, where it will allow you to read into multiple data sets, pick up insights from there, and not take the data away. The data stays where it is. So it still is, meeting all the regulatory needs as well as the data privacy laws that are there. And it is able to only take the insights away and then mix it across. So what it is doing is it's creating a better environment for a knowledge base. The errors that could possibly come in with just one or two data sets, that's getting eliminated. So it's able to rationalize the insights that it's coming out with. So that is something that is coming, that we've seen with AI, ML, in each and every space. Other area that we believe is going to be hugely revolutionary is going to be on the artificial augmented reality, or virtual reality or mixed reality that we see. So we'll see a lot of surgeries that will happen, which will be enabled by this technology. We already started seeing it in some sectors. On top of it, what will also happen is we'll see it in special healthcare elements also. Now, I earlier talked about cognitive therapy as one element. If I were to give a use case, how today Dell is actually helping this, or and enabling this, is that we're looking at trauma victims. People have gone through trauma in accidents, and if we are able to recreate the same situation and change the patient's stimulus or reaction, with the help of technology, that is something that we are investing on, and it's really paying dividends over there. So another area that we could speak about is with respect to robotics. Robotics with mixed reality type of environment could actually save a lot of lives, because you don't require the doctor or the specialist to be sitting right in front of the patient and doing it. It could be done from a remote location, with the help of robotics also. So I believe that today technology is there. The only problem that we are facing is it's very reactive in adoption. That it's triggered by something that goes wrong, like we saw in the pandemic, rather than it being proactively being used for changing the lifestyle of people, or of making it better. So that's a take that we have.
Right. Thanks, Sudhir, for those insights. And I'll ask Mr. Neelesh Shinde, Group Chief Technical Officer, Jupiter Hospital. Mr. Shinde, you heard both Dr. Mullick and Sudhir Nair as well. Sudhir also spoke about a lot of technology like AI, augmented reality, and other things. But he also pointed out a very important issue of privacy, data privacy, especially patient data privacy. So how do you think that hospitals are placed today in Tier 1 cities or Tier 2 cities when we talk about privacy of data? And what is the present scenario, and where do you see it's going towards?
During this pandemic, this pandemic taught us a lesson. Okay, in healthcare also, we have found out that a lot of opportunities are there, challenges are there. Now, if you see that now this artificial intelligence, machine learning, big data, all this terminology for the normal layman has come to picture in last couple of years only. Now, if you consider that we were earlier panel were discussing about pharma and healthcare, how the IT has been taken care. So, in real sense, if you say that, if you say Tier 2 and Tier 3 city, till now, whatever is available data, there was no concern as such about this healthcare in a hospital division. This CIO or digital information officer has really got people come to know about that in last couple of years. Now, when it comes to data privacy, there are a lot of data is available now. Now, if you see that with artificial intelligence, there are a lot of data is available, but how to save that? And the data privacy, that is going to play important role. So, personally, I feel that if you are having a good server and good people who can manage a full-timer, who can manage the server inside your hospital, but if you are having cloud-based solution, then you should have to have a good partner. So now there is the importance of having a partner who can store or maybe who can help you out in data privacy also. So it is not only the government, because now with National Data Health Mission, is going to be, data is going to be important role, going to play important role. And along with that, this data privacy, unless and until some law come and it makes mandatory for everyone that now the HIS platform also, if you see across the hospital, that is not on a common platform. So even if you want to send data from one hospital to other also, it will not able to talk to each other because the software language is also different, and this is not going to help us out anyway. So for this data privacy, some law definitely has to come where throughout the hospital, throughout India, whether it's tier 1, tier 2 or tier 3 city, there is a common platform where the data will get exchanged. And then only, and for all the data privacy, for cloud, it has to become cost effective, which is currently not there. So now what happens that down the line after 5 years, after this pandemic, we came across that everyone is thinking about insurance. So there will maybe an insurance from the patient who is going to pay through insurance, or maybe due to Ayushman Bharat. So these are the only two categories will remain after 5 years. So what is important here is that for this privacy, unless and until this cost-effective solution comes, we will not able to implement that throughout the hospital because everyone cannot afford that costing, and we cannot charge additional to the patient also. So these are the important things has to be there. We come into consideration, and I'm sure for data privacy with good laws and with good partners, we can able to do that.
Sudhir, just taking cue from what Mr. Neelesh has said, they are looking for partners who can provide affordable solutions for data privacy. But if I take that to a macro level, do you see that there are marriages happening between the hospital ecosystem and the technology service providers that way, which was supposed to be, or do you see that there's still a long way to go? Your thoughts on that?
So we believe that there's scope for improvement, large scope for improvement actually. And if you look into the US markets or you look into the European markets, data privacy and such things are very stringent over there. So where we can bring in value is that the type of practices that we are seeing, in those markets, we could actually bring those learnings, that knowledge base into India and, help as a partner and an IT consultant in your journey to adopt some of these practices. So that's one, area that is there. Second is, we're also seeing, like I talked about, new technologies. It's difficult for a hospital to evaluate on their own and find out, what works and what does not work. And that is where we bring in a lot of expertise on both the pros and cons of a new technology or a platform that is there. So once you're sensitized about it, you're looking at the cost part of it also. Now, one of the things that Dell has always believed in is that technology has to be affordable. And when you make it affordable, you make it available to the masses. And that is where we are completely focused on. So we look forward to any partnership that we could have with the hospitals or with the, with the authorities also, because we also talked about, regulations coming in on those fronts. So we are open to that partnership, and we look forward to any help that we can do, in India on any of these platforms, be it technology adoption, be it data privacy. But like I said, there's a huge scope because things are very fluid. The pandemic has just taught us some basic lessons. We still have a lot to go ahead.
Lot to go ahead, as Sudhir was saying. Neelesh, Shinde, if I again come back to the other question of telemedicine, how do you think that during the pandemic, technology like telemedicine has changed the relationship between the caregiver and the patient? How it has changed? Has it changed for good? Or do you think, again, there are a lot of things can be done in terms of telemedicine transformation, which can be seen in India?
Yeah, if you see that during COVID, in first semester 2020, telemedicine was not so active, but because first phase when it came, no one was aware how to tackle this pandemic. Because if you see that in a hospital setup also, there is a clinical team and non-clinical team. Clinical team were aware that what is this pandemic is going to bring about. But what about non-clinical or technical people? They were not aware about what is this COVID pandemic is. So first maybe 6-7 months, it was basically everything for a management point of view, it was our duty to make sure that we should boost our morale of our technical, non-clinical people, because that is very, very important challenge. Now, the question which you asked earlier was, what are the digital innovation? The small innovation which I came across is that, like we say that earlier we used to say SMS means short message servicing, but a simple message of SMS is like social distancing, mask, and sanitization. Now, how to reach to everyone? Because the kind of pandemic, what was the important thing was that communication, coordination, and cooperation. Because if you see that there are a lot of data was available on WhatsApp. Every day some new circular used to come. There were a lot of questionnaires from every region was having different circular. And because of this easy data flow, everyone used to get that. But then what to follow? That is also was a question mark. So simple thing like if you are having your own office, hospital is having your task force, with the help of WhatsApp media, like really it was used good way, that you can able to communicate fast with your entire team. So first 6-7 months it was like that, to make sure that morale of your own team is get boosted up so that they will able to fight. Because when we are saying that in hospital, there are a lot of things are there behind the scene, which is not be visible for anyone. Now, simple thing is that if you want to run the hospital, there are a lot of services are there. Now they will be run by the class 3 or class 4 people, or maybe some ITI guy who will do the HVAC or from the electrical side. Now morale boosting for them was very, very important, because question was there, for everyone was there, if it happens COVID to them, what will happen? What will happen to their family? So whether they will be able to go home or not. So all these queries which were there, so now someone has to do the morale boosting, someone has to give some motivational talk. So it was possible with WhatsApp media or maybe digital innovation, where we can have something on that. On your web side, you could say as an intranet, if you send some information, can reach to everyone. And then the time has come that everyone got a confidence that how to tackle with that. And then we realized that now first few months, obviously because patient or patient relative was not know how to come to a hospital also. So they then found out that there is an option called telemedicine or telematic. It was not there that it was not available earlier. It was there, but real boost up has come in during the COVID. And when it comes to telemedicine, the first thing was that doctor or consultant has to be like a registered medical practitioner. So now he has to make sure that whether this patient is really required that he can able to consult that on telephonically, or it's not possible. Because there are two options, that someone can only telephonically they can consult, or certain things that physically only he has to consult that patient. So now that was the first question which was there, whether how to determine that, how to define that, whom to give teleconsultation. And once we do that, because you have to find out that consent has to be there, because telemedicine laws were there, and everyone was new to that, and then the concern was that how to take the consent of the patient. Now there are two impact, that if he is directly communicating, he or she directly communicating with consultant, then it was okay, that is like implied consent. But like if consultant wants to talk to them and give some information, then some type of consent which has to be recorded was a basic question for teleconsultation. Then similarly that what type, whether the patient is there in India or outside India. So then what type of consultation he can able to give, whether this consultation is a repeat consultation or is a consultation which is that the first time it is happening. Then what type of prescription has to be given. So all these things were there, which were considering its teleconsultation. Yeah, that is a really good tool which was used during COVID. But if I see right now, the condition has changed. Because in India, we always feel that if we meet doctor 1:1, everyone feels more happier when they are having some issue. If you see also in digital way, we are going ahead, revolution is going to happen. But if someone is there in a hospital and if patient relatives accompanying them, then he always like to carry his CT, MRI, all the reports with them. And then he always feel that I have done something for the patient. And they always like to carry that bag along with him throughout the hospital. But if you give him just a small CD, they will feel there is something is missing. Because this is the Indian mentality. And I'm sure telemedicine and telemonitoring is going to play important role, but still in India, the personal touch for the doctor and patient is very, very important.
Yes, that's important. As Sudhir was also saying that in India, in a country like India, you always need a triggering to act on something. I think that, as you have rightly said, telemedicine has been in India for many years, but it has not been used like the way it has been used in last 2 years. I'll come to Mr. Dr. Mullick. Dr. Mullick, I can see 2, 3 questions coming from audience. If I may ask one of them to you. One question I can see is that how are the healthcare providers integrating with the insurance providers as that impacts accessibility? Your take on that?
Integrating.
Integrating.
See, lots of online platforms are now available where your whole insurance workflow, right from the time your insurance patient walks in, he sees a doctor, he is advised surgery, and then he has to go for pre-authorization. Right from that step to his admission to his discharge, the platform takes care of everything. The whole communication is platform driven, right? So most of the hospitals, including ours, we use one of those platforms, and they have become quite mature. These platforms appeared in India just about probably half a decade ago, and now many of these, we call them the RCM, the revenue cycle management platforms, and they've become pretty mature. And so you really don't have to worry about the quality of that manual guy who's sitting there. So the platform that we use, so the whole pre-authorization is done, it's idiot proof. So you don't have to worry about the quality of the person who is handling the pre-authorization. The one guy may be good, another guy may be bad. But then the platform guides them, okay, guy, you got to do this, 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 this. And then after that, the pre-authorization comes, the patient gets admitted, or once the bill is finalized at the time of discharge, the invoice is handled through the platform, invoice to the insurance company. When your billing guy prepares the invoice, the platform checks whether the invoice is in order. Every insurance company, every payer has its own requirements. I need 3 copies of this, I need 2 copies of this, I need a copy of this, I need a copy of that, otherwise I'll return it. So they have pair-wise checklists by which they will check whether your invoice is correct or not. And if there is anything missing, they will go back, no, sorry, the following 4 documents also required. Then only the invoice can be processed successfully. The invoice goes through them. They will chase the insurance company also on your behalf that this invoice is unpaid. They will start chasing after the minimum time period they elapsed. So, and they do it for, now there's so many competing platforms, they do it for a fixed fee of a couple of ₹100 per patient, right? So that has been the change in the last 5 years.
If I may ask you that, what kind of change you're anticipating for coming 5 years or 10 years when we talk about the improving patient care, especially leveraging more and more technology innovation? So your thoughts on that?
See, the most important change that must come, that has to come, without which nothing will happen. Like my friend from Dell, he said they are doing AI. Now, AI ML need, as he very rightly agreed, that you need large data sets to do AI ML properly, to get the right kind of outputs from it. Now, where are those data sets going to come? Are they going to come from your case sheets, from your paper case sheets? They can, but it could be very, very expensive and very, very time consuming. They have to come from your EHR systems. Where are the EHR systems in India? This is the one thing where all administrators, all technology companies, the government needs to get involved. Unless you have EHR adoption, quality EHR adoption, at a large scale, nothing is going to happen. Trust me, nothing is going to happen. We'll just keep on meeting and talking, and we'll keep on hoping that something will happen, right? The government did the right first thing. They published EHR standards. So this is the Indian EHR standard version 1, version 2. I believe version 3 is going to come out. But after that, the next follow-up step is, I was always hoping next year they are going to mandate it. Next year they are going to mandate it. In a couple of years, they are going to mandate it. Not yet happened, right?
So I think mandating of EHR by the government will be the most important thing according to you.
Yeah, it's a carrot and stick. They don't mandate. They said, okay, You do it, so I will reward you. You will get 10% extra payment or 5% extra payment. If you don't do it, if you send me manual records, I will dock 5% payment. That's how NABH took off, right? Even today, why do hospitals run for MBA? Not because hospitals are interested in quality. Sorry. Hospitals are interested in NABH just because they get that extra percentage of payment.
Harsh, really it is. Mr. Neelesh, your thoughts on the future?
Definitely, I feel that we need to change our mindset. Okay, things will happen. May not be immediate. India, nothing happens very fast. So slowly but steadily, I'm sure it will happen. Now, artificial intelligence, currently, if it's in oncology, artificial intelligence come. But only thing that till so many years, we were having a lot of data, but we never understood the meaning of storing that data. So unfortunately, we don't have data. So now the data which is available is currently from US or maybe from the European countries. But now we understood the importance of data and we started storing that data. So down the line after 5 years, this artificial intelligence is going to make a boom in India. Time will come, but I'm sure it will make a difference. Along with that, if you say that robotic surgery, which is currently we are using in our hospitals also, and it is making a difference, means for patient, the outcome has improved, cost is same. So for patient is always beneficial. So those small things definitely will going to make a difference in the healthcare deliverables. And the gap which we are saying that now, importance of like critical care center or EICU, which has come up. Because if you see that there was no facility available during COVID, you have seen a real ICU facility available in tier 2 or tier 3 cities. Time will come, now everyone understood at least what can go wrong. Now, if you see that in India, we face a real lack of oxygen also was not available. Now everyone understood. Most of the places you have seen that the oxygen plants has been created. Now similarly, this EICU also, because currently if you see the ratio of the consultant and the patient, there's a ICU consultant patient, it's a huge gap is there. But concept like EICU, where sitting at one command center, if you can able to connect this ICU, and as I told just now also, if all these hospital providers, if we get the right a partner to do this, all this technology evolution, things will definitely is going to improve. Because reason is that when we do all these things, everyone is having in their mind what about data privacy, how the infrastructure will be there, how we are going to transfer the data which is available multiple folds. So a good partners are going to make a difference which will really boost the confidence. I'm not talking about few hospitals who can able to do it. I'm talking about entire India. When we are saying entire India, that multiple booster dose, the way we give it, similarly it is required now from technology provider to all these healthcare providers. And I'm sure India in digitally, definitely there will be transformation there. Only thing, mindset has to change. So how much I am going to adopt or we are going to adopt in healthcare is going to make our future. So this COVID pandemic has taught us a lesson for everyone. So it is a beginning, but it will happen. Because in India, everything happens on the great leadership. So still we are hopeful that things will improve.
Let's hope for the best, Mr. Neelesh Shinde. Sudhir, Nair, your take on the future collaboration opportunities between the industry and the hospital administrations or government, especially when we are talking about transforming healthcare through technological innovation. Your thoughts on that?
So while I started off saying, that we're being reactive in many certain, areas, what it also means is the government coming in and, bringing in a platform is something that will help everyone. Technology is available. It's important that partners like us collaborate jointly, with hospitals, with also healthcare professionals. in terms of giving them the right view. A simple thing like sir mentioned, was about adoption of cloud or on-premises, making that choice of where your infrastructure should lie, what technology platform should you adopt it, at what, what is the adoption curve where you should get onto it. That is also very important. And where do you see the ROI or the TCO by doing the technology adoption? So this is something where I believe it will revolutionize. It will take a couple of years because we have just started on that journey. But the good thing is that the pandemic has actually got us onto the bandwagon. So I believe technology can be very, very revolutionary with all the digital adoption. While we are being reactive, there is a lot of things that we can do being predictive. And that's where these technologies will help us. AIML, or, talking about augmented reality or mixed reality. It's about, enabling that potential that we are not unlocking today. That's where it will help us. And I see technology being a major enabler. So if you look at most industries today, and I'm just giving an example, banking and finance for an example. Today, technology plays a major role there. The CIO is a part of the business plans actually. So that's where we believe technology will move in the healthcare industry also. We look forward to partnering with each one of you, be it the industry, be it the hospitals, be it the healthcare professionals, in terms of bringing knowledge base, in terms of bringing expertise, and the IT consultancy part of it also, which can enable your business. So long way to go, but it's a great start that we've had actually.
Right. So if I take a crux of what has been discussed for last 45 minutes or so, one thing as Dr. Mullick has said in the beginning that there are a lot of things needs to be done from the government end. Hospitals also have to do a lot of things to create that kind of effective ecosystem. As Mr. Neelesh Shinde was saying that things are happening, but a lot of things needs to be done. In terms of the mindset has to be changed if we have to embrace technology in much more efficient way. And as Sudhir Nair was saying that transformation is happening, and today or tomorrow we have to embrace emerging technologies and for various aspects of that technology, and again that partnership, that collaboration opportunities are there. So that brings us to the end of this panel discussion on accelerating patient-centric transformation and innovation in healthcare. I again thank Dr. Aloke Mullick, Group CEO, OMNI Hospitals, Mr. Sudhir Nair, Senior Manager, CSG Sales Enterprise, Dell Technologies, and Mr. Neelesh Shinde, Group Chief Technical Officer, Jupiter Hospital, for joining us today. I'll request Consulting Editor of APAC Digital Network, Mr. Rajneesh, to come on stage. And
I would like to just end with one thought.
Yeah, sure.
See, technologically, most industries in India and overseas, they are much more mature than the healthcare industry. And this maturity is measured by your spend on technology as a percentage of a revenue. Most mature industries, like say manufacturing, they would, Sudhir would agree with me, they would spend about 4 to 5% of their revenue on technology. Most hospitals will spend 0.5% of their revenue. Why I keep harping on the government is not that the government has to spend money. Government has to mandate by legislation. When it is mandated by legislation, it's not that the hospitals cannot spend that money. They can spend that money, but they're unwilling to spend that money because today they don't have this monkey sitting on their head, oh, if I don't do this, I will be penalized, right? The technology is available. The adoption push is not available. Once the adoption, they are unwilling to commit even 2.5% of their revenue for technology. That is the basic problem.
Again,
right.
As insightful as ever, Dr. Mullick. Thank you so much. And on this note, I request Mr. Rajneesh to come on stage and hand over the souvenirs to our esteemed speakers. We can start with Dr. Aloke Mullick, Group CEO of OMNI Hospitals. A huge round of applause for him. To Mr. Neelesh Shinde, Group Chief Technical Officer, Jupiter Hospital. To Mr. Sudhir Nair, Senior Manager, CHG Sales Enterprise Dell Technologies. You can have a group photo. Rajneesh ji, you can also be there. So that was a panel on accelerating patient-centric transformation and innovation in healthcare. With this, we move to the next panel discussion on Indian diagnostic sector, diving deep into digital technologies. The way forward, I request Rajneesh De to be on stage because he will be playing the role of moderator. And speakers for these sessions will be announced by Rajneesh De himself. Over to you, Rajneesh.